This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Our immune system is in charge of defending our bodies against germs and viruses. But when lupus attacks, our healthy tissues are suddenly at risk.
Lupus is a chronic autoimmune disease or condition that could be systemic or localized. If it's systemic, we name it as systemic lupus erythematosus. It's a disease wherein the immune system of the body attacks its own body. It would affect any part of the body, usually the skin, the lungs, the kidneys.
Anyone can develop lupus, but medical experts have zeroed in on certain groups of people that are most susceptible to this autoimmune disease.
To fulfill the criteria for lupus, we have a screening test, which is the anti-nuclear antibody, and then we have other lupus-specific autoantibodies.
90% of those who have lupus are mostly women, especially those of childbearing age. Lupus is quite difficult to detect, but some signs leading to it can manifest.
So meron kaming tinatawag na criteria for clinical diagnosis of lupus or systemic lupus. Kailangan ma-fulfill ito. Ang mga ito ay tulad ng pagkakaroon ng rash sa muka, yung tinatawag na butterfly rash, ang pagkakaroon ng malimit na singaw, ang pagkakaroon ng pamamaga sa kasukasuan, ang pagkakaroon ng protein o protina sa kidneys, pati na rin ang pagkakaroon ng pamamaga or pag-ipon ng tubig sa balutan ng baga or ng puso.
The moment you suspect that you have lupus, it is important that you seek medical attention to prepare yourself well. What kinds of complications can lupus cause? What lifestyle changes can you make to help keep lupus under control? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Marian Galdones, a rheumatologist from the University of Santo Tomas Hospital and a diplomate of the Philippine Rheumatology Association. Also with us is Dr. Sora Briones, a rheumatologist from the University of Santo Tomas Hospital and a diplomate of the Philippine Rheumatology Association. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Tonight we'll be talking about lupus. So to start off our discussion, what is lupus? Let's start with you, Dr. Sara.
Lupus is an autoimmune disease affecting multiple organs in the body. What happens is that the antibodies, the soldiers that protect and defend you from foreign invaders or germs, go out of control and start attacking the normal cells. So you could have inflammation in some parts of your body. This could present as rash, oral ulcers, fatigue, and arthritis.
You mentioned the word autoimmune. Dr. Marian, what exactly is the word? What does it mean, autoimmune?
Well, the immune system, we have this immune system in our body. The immune system serves as soldiers. So as Dr. Briones mentioned, the soldiers, their function is to protect us from invaders. Okay? So what happens in autoimmune is the soldiers, supposedly protecting us, attacks our own
So parang
body.
they turn against us.
Yes, they turn against us, or it can be compared to us parang coup d'etat. No? They attack our own cells in the body. So what happens is, depending on the organs that they attack, so if they attack the kidneys, then we have what we call the nephritis. And if they attack the parts of the skin, then that can manifest as rashes.
Is there an explanation as to why they attack us? They attack our bodies.
The cause is generally unknown, but you can have genetic predisposition. And if you have exposure to certain environmental elements, lupus can be activated.
We've talked about the soldiers in our body that attack us. Let's go to what is the normal way that our immune system functions without these attackers? How does it work, or what happens to the regular immune system?
So the soldiers, the antibodies, normally destroy the germs, the bacterial infections that we have. But in an autoimmune disease, what happens is that these autoantibodies attack the normal cells. So you could have inflammation in the body, especially if exposed to certain environmental elements.
And inflammation in the body, since our topic for tonight is lupus. So how does it manifest? How does lupus manifest in someone whose soldiers have attacked their system?
You can have a rash. The butterfly rash is very characteristic of lupus. You can have unusual hair loss, oral ulcers, inflammation of the kidneys, and may manifest as bipedal edema, yung tinatawag na manas. You can also have fluid in the lungs and in the heart.
Dr. Marian, the manifestations that Dr. Sora said can also mimic other types of bodily malaise. How do you differentiate the two and determine that one has indeed lupus?
Well, differentiating lupus from other diseases can be sometimes challenging to doctors. One, lupus can mimic TB, for example. Lupus can mimic infection, and sometimes lupus has also the same manifestations as those patients with cancer, like for example pains. Some lupus patients complain of joint pains, and some patients with initial manifestations of patients with cancer also complains of pains. So very, very non-specific. Lupus presents in a variety of ways. So it's really difficult. It's a matter of, the physician being sharp of recognizing that this is part of a syndrome.
You mentioned the physician being sharp in recognizing the syndrome. Is it easy to diagnose when it gets to you already?
Yeah, when the patient comes to me with rashes and then complaining also of joint pains, and if that person is a female, then that should ring a bell already. Then you probe further. You ask the patient, have you have excessive falling of hair? Then these are manifestations of SLE already. Or does she have oral ulcers? It affects any part from head to toe. So the doctor should be very keen in probing or investigating what does this patient have, because other patients don't volunteer all the information. Sometimes they think it's not part of a syndrome, but if you ask further, then you can tell that it's already part of a syndrome that we are looking in SLE.
You mentioned SLE.
Yeah.
What exactly is SLE? Is this a type of lupus, Dr. Sora?
There are two types of SLE. The discoid lupus is the milder form, and it affects primarily the skin. What happens is that the patients can have permanent scarring from the rash or permanent hair loss. And the more potentially serious is the systemic lupus erythematosus, or the SLE, wherein you can have damage to the organs involved. So this damage can lead to permanent loss.
Does this develop with time, or does this just come out with no provocation? How does this manifest?
Usually there is a predisposition or a trigger. This could be sun exposure, infection, medications that you're taking, and also the food that you eat could trigger these manifestations.
So when you're exposed to the sun and medicines
if you have
you're
the
taking,
genes, and then the right combination of genes
Plus
and environmental exposure can trigger
The rash or the pain in the joints?
Yes.
Ganon ba yun?
that can trigger the immune system to get crazy, to get confused.
Okay.
That happens.
If you already know that you have a family history of lupus, then you should stay away from these triggers. Is that correct?
Not necessarily.
Okay.
But we can be more vigilant. If a family member has lupus, then we don't tell them to be praning or what. Just
That's the last thing you'd want,
Yes.
not to
Yeah.
scare or to make them feel praning.
Yes.
So
still
how do you
live life normally.
So how do you keep them at ease or give them that peace of mind that it can be cured? There's nothing to be praning about when you already know that you have a history and there are certain triggers that can aggravate it.
You have to be educated about your disease in order to embrace the disease. So, family members are advised to support their family members. Okay, and patients should follow the doctor's advice and eat healthy.
Eating healthy, I always hear that from our guest doctors, to always eat healthy, a balanced diet, to be more careful and more vigilant of the triggers and the family history. Speaking of family, is it true that women are more prone to having lupus?
Yes, women are primarily affected. It's probably because of the estrogen or the hormones, or it could be because of the X chromosome. But we've encountered men and children who have lupus. It primarily affects the age group between 15 to 35 years of age, and women outnumber men by 15 to 1.
Why is that? Why are women, aside from the estrogen, the hormone that we produce when we're premenstruating or when we're pregnant, why does it affect
has something
women?
to do with the hormones. The specific pathophysio, it has not yet been identified, but it has something to do with the hormones and probably the X chromosome that the female has.
So does it necessarily mean that the females have it more? Is it more painful for them, or is it more uncomfortable for them than the children and the males who experience the same thing?
It's probably because that women have low threshold for pain.
Really? I thought we have a high threshold for pain.
That's why they're more health conscious. That's why they seek consult of their ailment as compared to men.
Okay, so women are more vocal when it comes to their health issues than men? Okay. Okay, doctors, will talk more about tonight's topic, which is lupus, when MedTalk returns.
Did you know that lupus is the Latin word for wolf? The term came from 13th century physician Rogerus, who described a person affected by lupus as having scarring facial lesions that were similar to that of a wolf's bite.
We're back here on MedTalk, still talking about lupus. Now, doctors, this time, let's talk about the symptoms. We talked about the triggers and what the autoimmune system is all about. And, the word that stuck to my head was the soldiers that attack. Yung coup d'etat, they attack you inside. And now let's talk about the symptoms of lupus. Are all symptoms alike per individual who is diagnosed with the disease?
No two lupus patients are alike, and each symptom can occur one at a time. And besides the rash and the arthritis, some patients could develop seizures.
That's an extreme case.
Yes, very difficult to treat. And some would present an myocardial infarction. So that could also occur in patients
with a myocardial infarction?
Heart attack.
Oh, okay.
So
all right.
It could be an initial manifestation of lupus. And very common and also difficult to treat would be the inflammation of the kidneys, which we call nephritis. And if it's very grave, sometimes they would require kidney biopsy in order to distinguish what stage you are with this inflammation.
Doctors, before we continue our discussion, we have a question from Twitter. Is it safe to be pregnant if I have lupus?
First, fertility rate in women with SLE is comparable to that of the normal population. However, we generally advise our patients to carefully plan their pregnancies because pregnancy itself is a stress that could trigger or worsen their symptoms. And women with SLE have higher rates of spontaneous abortions, intrauterine fetal deaths, and premature births. Ideally, patients should be in complete remission for at least 6 to 12 months before they can get pregnant or before a favorable pregnancy can occur.
So if she has completed that 6 to 12 weeks and there's a go signal from her doctor, and now that she's pregnant, is there a chance that the baby, she can transfer the lupus disease to her baby?
Yes, there are certain antibodies that can pass through the placenta and can be passed on to the fetus. And there are certain periods during the pregnancy wherein we could test these antibodies from the mother, and we could predict whether the fetus could have this lupus. And the particularly affected part in the fetus would be their hearts. And they could also have rash when they're born.
Okay, but what's the rate of the fetus having lupus as well?
It's not a common occurrence, but
it's good to know.
Yeah, but if a mother has this certain antibodies, we test this in the pregnant woman. If this particular antibody is present, then we monitor the baby more closely.
Okay. Doctors, this time a question from Facebook. I have sores in my mouth because of lupus. What medicines can I take to ease the pain? So it can also manifest in sores.
Oral ulcers.
Yeah. Oral ulcers. Oh, wow. Okay.
Yes. Actually, it depends.
That's not herpes, huh? When it's, diba, it can mimic as herpes.
Yes. So, if you have lupus, you're predisposed to develop infections. So you could also have a viral infection. So you have to identify if it's a viral infection and address it, take an antiviral drug. But if it's if the oral ulcers is primarily due to lupus, you might need to increase the steroids, but it should be guided by the doctor. So I think she should consult her doctor.
Okay, Dr. Marian, you'd like to add to that? Difference between herpes and lupus when it's an oral sore?
It's difficult. If it's part of a lupus activity, the oral ulcers, then usually look for other manifestations like do you have joint pains, increase in hair falling, or what we call alopecia. And if there's none, if that's just an oral ulcer, then most probably it's more of a viral infection rather than a disease activity of SLE.
Is it cause for alarm that you should go to your doctor right away once you
yes. To assess? It's difficult to assess. It has to be seen by a trained eye,
and not your own
Yes.
trained eye. If you think you have your own trained eye when you see all these things, sometimes we tend to self-medicate because we don't really would like to seek the medical advice.
And the problem with self-medicating is if that's a viral infection and you decided to increase your steroids, then that would that would aggravate more the infection because you suppress your immune system more if you increase your steroids. And if that's a viral infection, then what we need is the immune system to attack that virus and not suppress it. If it's a disease activity of lupus, then we need to suppress the activity, then we need to increase the steroids. So
to balance. Balance talaga. You mentioned the word we need. Now we need to know, our viewers I'm sure are wondering, we need to know what are the complications that are brought about by someone who has been diagnosed with lupus. Dr. Zora.
Okay, the more commonly seen would be the inflammation of the kidneys. And it has to be detected early on. If left untreated, it could lead to irreversible inflammation that would result to end-stage renal disease, wherein you will be put on lifelong dialysis. Okay, and some, if the inflammation is uncontrolled, you could develop stroke, a heart attack. So could be immobilized for a long period of time. And also, I've mentioned about a pregnancy, which could trigger a flare. It could lead to pregnancy loss if you have a disease activity while you're pregnant.
So why does it reach that stage, the complications, when we're trying to prevent it and catch it early on? Dr. Marian?
because there's a continuous inflammation. So
lupus is a chronic
it's an inflammatory state.
And it takes time to achieve remission. So one visit is not enough to control the disease. You need several follow-ups in a month before you reach a stage of remission. So lupus is a period where you can have exacerbations or worsening of your symptoms, and also a period of remission wherein the medications that you're taking has already achieved or suppressed the antibodies that go out of control.
So we don't want it to reach that stage, Dr.
Yes,
Marian. We were talking about it earlier, that we don't want it to reach that stage, but why does it get complicated and lead to these other diseases?
Because one thing also, the treatment that we use can also have complications, the side effects that we use. Like, for example, steroids. Steroids is a good medicine, but if it's abused, then it will bring a lot of problems to the patient. That could also be a complication, that can bring about a complication to the patient.
What do steroids exactly do?
Like, for example, they can increase your sugar, can cause diabetes, it can cause osteoporosis, it weakens the bones, a vascular necrosis, it can result to cataract. What else? There's a lot of bad side effects of steroids. That's why if there's a disease activity and you want to, it's like fire, we want to put the fire out immediately, then we give steroids. But if we can see already that, okay, we can taper now the dose of steroids, then we will do that. Because the longer the patient is on high-dose steroids, the more problems that we're going to encounter.
But this is an extreme case of someone who has lupus, someone who is on steroids already?
Actually, it's not an extreme case. It's something that we deal daily. We consciously, as rheumatologists, we constantly ask ourselves, does the patient need high-dose steroids, or can we now taper it already?
About those with the mild diagnosis of lupus,
Sometimes
do they need it?
Sometimes they can apply topical steroids if they're a rash. However, if oral steroids be avoided, we use another type of oral medication, the anti-malarial drugs. So these drugs are very helpful for rashes and arthritis. But in some cases that inflammation cannot be controlled by steroids and these anti-malarial drugs, we also resort to chemotherapeutic drugs. That's why if given for a period of time, women can experience premature ovarian failure. So they can no longer have children or have their periods.
But it's because of the medicine, not because
of the
Not because of the disease, it's because
Yes.
of the medicine.
Yes.
And
Yes.
hopefully, those who have been diagnosed do not go through that.
Yes.
Women who would like to
Have
have children do not
yes.
go through that. Doctors, we have a question from Twitter this time. I read online that lupus can cause hip fracture. Any truth behind it?
Yeah, it could be that the hip fracture was as a result of weakening of the bones secondary to chronic steroid use, or could be a result of the chronic inflammation itself that causes also osteoporosis, weakening of the bones. So both the disease activity can cause weakening of the bones, and the medications that we use to control the disease activity can also cause weakening of the bones resulting to fracture. Not only hip, can also be the spine or wrist or any bone.
Any bone in our
But most
body.
commonly
It's
it's
most affected.
the vertebral fracture and the hip.
Doctors, before we cut to a break, quickly, is lupus painful?
Sometimes, yes. Most of the time, sometimes.
Sometimes. We'll talk about that. We'll quantify that. When MedTalk returns, we're talking about lupus.
Did you know that former President Ferdinand Marcos died of multiple organ problems caused by lupus in 1989? At first glance, Abby looks like a regular college girl. But unlike many ordinary girls her age, Abby has lupus.
Gagraduate na ako ng high school, tapos yung papa ko po namatay. So na-trigger po yung mga symptoms like hair loss, nalalagas yung buhok, tapos oral ulcers po. Yung pag nagtututbrush, laging may dugo. Tapos fatigue, hindi po ako makastand sa init ng araw. Lagi po akong masakit po sa tuhod pag naglalakad. Tapos on and off na fever po.
Severely affected both physically and emotionally, Abby struggled to cope at home and at school.
All of a sudden, biglang bawal na. Bawal sa maalat, bawal ka ma-stress. Sa activities, bawal yung strenuous kasi affected na yung joints mo. Mabilis sumakit yung mga buto mo. So bawal ka na sa sports, nahilig ko dati. Tapos wala na ngayon. So maraming changes na yung nangyari.
But with the help of people in her environment, she was able to adjust and manage the disease. Now 20, Abby was not just able to overcome her fears, she has also been able to inspire others, offering support to those with lupus as an active member of PEARL, or People Empowerment for Arthritis and Lupus.
Para po sa mga katulad ko na may lupus, wag lang kayong mawalan ng pag-asa. Marami ka pang kayang gawin kahit na may lupus ka.
We're back here on MedTalk, still talking about lupus. You may join the discussion by calling our hotline at 548-4678. Doctors, before we cut to the break, I asked if lupus is painful. And you said, not really, sometimes.
Actually, it depends. If there is muscle involvement, you can't do your daily activities. You can't brush your teeth, you can't get up from your bed, or can't even brush your teeth. And if your joints are involved, you can't hold your mug or open the door. So it depends. The patients do not present the same gravity of arthritis or muscle involvement.
You mentioned the word arthritis. It's an inflammation of the joints. How do you distinguish the pain of an inflammation in your joints and the pain of lupus?
Okay. In lupus, you have to take in the other symptoms. You have to meet 4 out of the 11 criteria, and arthritis could be part of that criteria. But arthritis could be a presentation of other degenerative disease or other autoimmune disease. If a patient presents only with arthritis, just go to your doctor and observe it, take some medication. Hopefully, other symptoms won't appear.
But does arthritis lead to lupus, Dr. Marian?
No, not necessarily. When we say arthritis, it's just telling us that there's an inflammation of the joint. When you say inflammation of the joint, it can be caused by several factors, or it can be caused by a crystal. That's where the gouty arthritis comes in. Okay, and then it can be a reactive arthritis. If one has an infection and the immune system is active, then the joints can be swollen. That's a form of reactive arthritis. But in SLE, the immune system attacks the joints, so there's swelling. So it's not really arthritis can lead to lupus. It's more of arthritis may be a manifestation of lupus.
So arthritis can mask, so to speak, the lupus that you are experiencing, that you have.
It's
part of that.
It's
part of the 11
Yes.
criteria when you're diagnosed with lupus.
When we diagnose a patient with lupus, we follow a certain criteria. We call the ACR, or the American College of Rheumatology criteria, wherein there are 11 parameters. And if the patient, these 11 parameters includes, we have mnemonics, dopamine rush. For med students, they can they can pick this up.
For non-med students?
Well, dopamine rush. D is for discoid rash. O, oral ulcers. P, photosensitivity. That means when a person is exposed to the sun, they develop rashes. So that's photosensitivity. A, arthritis. M, malar rash. The
butterfly rash.
Yeah, the butterfly rash. Where are we now? I, immunologics. When we test for the
Certain antibodies.
Yeah, that's the ANA. The anti-dsDNA, that's more specific for lupus. If that's positive and you have all these manifestations, that's one criteria that we're looking for. And then the neurologic manifestations, then renal manifestations, and then what else? Serositis. There's a water fluid around the heart or around the lungs.
And these these manifestations are only confirmed by the doctor upon the test conducted. What kind of test is this? Is this a regular blood test? Is it a special blood test that you guys have or that you guys conduct?
Initially, you could request for a complete blood count wherein you'd find anemia, a low WBC count, and a low platelet count. And some doctors would initially treat patients for having dengue fever, but they don't have. And urinalysis would show a pus cell. So they will be initially treated as a case of a urinary tract infection, but it's lupus. If you have high index of suspicion, then you request for these expensive antibodies, like the anti-nuclear antibody, which are also not available in all laboratory centers or hospitals. So it has to be a clinical eye to test these antibodies, because sometimes these antibodies are also present in normal individuals.
Yes.
These individuals are asymptomatic, but they don't have to take medications to treat the antibodies that are present.
So a positive ANA would not tell you she has lupus. If that's only the one thing that's positive and no other manifestations that I mentioned earlier, the dopamine rash.
Yes, the 11.
The 11. If you did not meet 4 out of 11, then probably it's just a mimic.
Maybe you're also stressed, because stress can also be a trigger and mimic all these other manifestations. Let's talk about our case study, Abby. She has been diagnosed with lupus. It has taken a toll on her emotional and physical state. How does one cope with being diagnosed with lupus, and how do you live your life with this disease?
Yeah, for patients already diagnosed with lupus, with the physical changes, the rash, sometimes they get bald because of the excessive hair falling or the alopecia, then they tend to have low self-esteem, and then they go into depression. Some of them would even have suicidal tendencies. But then again, as I've mentioned, there is a neurologic involvement in SLE. Those depression, suicidal tendencies can be a manifestation of SLE also. So they're overlapping. So that's why it's a challenging disease, okay? Because manifestations can be brought about by the disease activity itself, or as a result of knowing that you have the disease.
Yes.
Okay, so you get depressed. Some, I've mentioned suicidal tendencies.
Debilitating disease.
Yes. Some feel that they're isolated. They're the only, because it's not that common, although it's not rare, some feel that they're the only ones who have that disease. So it's very good, very helpful for them to join support groups.
I was about to ask about the support group, because
Yeah.
you can't handle it on your own. You really will think of so many things because of the disease that's consuming you.
And there are a lot of advantages in joining support groups. Number one, you feel, oh, I'm not alone. Other people have lupus pala. And then hearing their stories, how they, their trials, and how they were able to cope up, sharing coping mechanism, that would really help them. And then we also encourage the caregivers to join the support group, to accompany their patient or their relative to understand the disease. Sometimes kasi nagiging masungit ang mga lupus patients.
Dapat the patient has
they're feeling pain.
has to be given patience by the support group
Yes.
and their family members, because it's not easy. I mean, sometimes siguro even if they want to express how they really feel, there's so many things going on inside their body, and they're not able to do so. So patience for the patient is of utmost importance, so to speak. And another thing that we deem important here on the show is our Facebook question. So we have another question from Facebook. Is lupus connected to cancer? You mentioned chemotherapy earlier, that a patient who has lupus might have to undergo chemotherapy. So any relation to cancer if one has been diagnosed with lupus?
Lupus patients have higher chances of having cancer. It has been based on several studies, but the use of chemotherapeutic drug per se is to control the inflammation. Sometimes patients who have kidney involvement we have difficulty in controlling the activity with just steroids. So we need the help of other medications.
And you mentioned help of other medications. What other treatment options are available for a person who has been diagnosed with lupus? Dr. Marian?
Yeah, we mentioned prednisone. So that's what we use, prednisone, steroids. That's what we use to put out the fire immediately.
Okay. Is that an immediate relief?
Yes.
Once you
there's an
take it,
immediate
talagang
relief.
it
it's
will suppress the pain.
It's a wonder, it's a magic drug.
Okay.
And then that's why people tend to abuse it. So we have to educate that do not abuse steroids. It has to be under the guidance, or you have to be guided by your doctor in using steroids. And then we also use, part of our armamentarium is we borrow from, we have this anti-malarial drug.
Okay.
The chloroquine or hydroxychloroquine.
Is that topical or
No,
oral?
it's oral.
Okay.
It's an oral drug that's very good, especially if the lupus manifestation is mild. We consider mild manifestations as rashes and joint pains, arthritis. So hydroxychloroquine is very good for that. And then for, we also use immunosuppressives like mycophenolate mofetil, like that.
Those are all oral.
Oral.
For the rash, before we cut to a break, for the rash that comes out, is there a topical ointment or steroid that you can apply so that it doesn't get to be too inflamed, or that the rash goes away right away?
You can apply topical steroids if the rash is just mild. But if the rash is accompanied by other symptoms, you can take the oral steroids and the anti-malarial drug.
You really have to take something oral for it so that the inflammation goes down.
Because
Is that
it's
correct?
systemic. It involves not just the skin. If you have the systemic lupus erythematosus, it involves
Your entire
body. Yeah.
Okay.
And aside from that, we have the newer drugs, the biologics. We use it for, it's the higher, it's a ladder. We use first this one, and if it's not controlled, we go on higher. And then the newest is the biologics, because it's also expensive.
Okay, so expensive but effective.
Yes.
Okay. Doctors will talk more about lupus when MedTalk returns. We are back here on MedTalk. Our topic for tonight is lupus. Doctors, we have a question, this time from Twitter. Are there exercises I could do to keep myself healthy?
Yes, actually we encourage patients to really exercise.
Any specific type of exercise?
As long as it's indoor, you don't want to
Oh,
expose.
because sun exposure can trigger a rash or pain in your joints.
Yes.
That's bawal.
And you should not overdo the exercise, because overdoing it could also stress and trigger a flare. So any form of exercise.
Any exercise, just do not overdo it.
Okay.
Okay, muscle strengthening exercises.
So the at-home machine, yung mga
pwede.
machines na
all
you
right.
can purchase and do your
Yeah.
activity at home, or watching a DVD like a yoga exercise or
Yes,
something,
all
or
right.
walking at night. There's no sun.
Yes.
You can do that.
all right.
Brisk walking,
Yes.
30 minutes, 3 times a week can be enough. Yeah.
And the lifestyle change. What kind of change should you
Just avoid the sun.
just that about food?
They need to eat healthy. There should
Balance.
A
What is
well-balanced diet.
healthy? You know, there's such a debate with eating healthy and eating right. What's your take on that?
It should be well-balanced. You have fruits, vegetables, dairy, a small portion of meat.
Okay.
Because SLE or lupus is associated with accelerated atherosclerosis. I've mentioned a while ago that you're more prone to develop heart attacks and strokes. That's why we advise our patients to lower down their salt intake and lessen their fatty food intake. So that would be their take-home advice.
It also
Dr.
depends
Marian.
on the comorbidities of the patient. If a lupus patient has this nephritis, lupus nephritis, and usually they have high BP, blood pressure. So we advise them to avoid salty foods, because that can increase more their blood pressure.
So a turnaround, so to speak, when it comes to living healthy, eating healthy, and getting the proper exercise. I have to ask, is sun exposure, you said, triggers, but vitamin D is good for us, it's good for the skin.
Yes.
So at what point, in the morning, or would you still recommend that lupus patient
For lupus
get
patients?
vitamin D, or you just take vitamin D orally just to get that vitamin
For
D into your
lupus
system?
patients, since they should not be exposed to sunlight, then we just advise them to supplement.
Okay, so oral.
Oral.
For those who just would like to enjoy the sun, I
Yeah, without
have to ask
lupus
that.
patients, ideally, the time is between 10 a.m. to 3 p.m. That's the ideal time, but don't spend most of that whole time bathing under the sun.
Yes, that's also bad.
Yes.
Through the years, if you expose yourself between those hours, you might get skin cancer.
Yes.
20 minutes?
Can be 20 minutes, 15 to 20 minutes.
3 times a week. would
20
be-
minutes, 3 times a week of the good sun, vitamin D. How about home remedies? Since our other lupus patients stay at home and are not able to work and are not able to do their daily activities, go out, what are the home remedies to relieve them of their pain?
When you ask for self-medication like that, no, we don't advise them.
Or maybe like an alternative to the medications that they take, something else to do at home?
Okay. We don't recommend self-medication with herbal
Yes.
meds because
Yes.
you don't know the exact dosage and it could harm your kidneys. But if you have arthritis, you could soak your hands in warm water, apply warm compress. So that would be the home remedy for lupus patients who have arthritis.
Okay, so warm compress.
Yes.
Okay, that relieves them of the pain in their
Yes.
joints. Okay. Doctors, if there's one thing that you'd like our viewers to remember on this episode about lupus, what would it be? Dr. Sara?
Lupus is not contagious. Patients and family members should not be scared of the disease. It's very common among Filipinos and you need the support of other patients. So come and join us in our lupus clinics in UST Hospital and in St. Luke's, and some other provinces also have lupus group support. So
PGH also
you
has
can
their-
check our Facebook page at Pearl People Empowerment for Lupus and Arthritis. And we also have www.redfee.org and www.luisaproject.org.
Dr. Marian? Thank you, Dr. Sara. Dr. Marian?
Message for the patients with SLE, don't lose hope. Okay, we have the doctors now are understanding more the disease, and we actually can manage the disease now compared to 10 years ago, which lupus before was very fearful word.
Yes. People were afraid of someone who might be diagnosed or who has been diagnosed with lupus kasi baka nakakahawa.
But right now, we at least understand more the disease, and then we can manage more the disease. Don't lose hope. Seek regular consultation with your doctor. Don't self-medicate. Protect yourself from the sun. Put on sunblock, at least SPF 30, and then umbrella. And then for those people who does not have lupus, it's not contagious. Don't be afraid of those people with SLE. Give them equal opportunity. They are also productive members of the society.
Thank you very much, Dr. Marian and Dr. Zora, for the opportunity to understand more about lupus. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night, everyone.